disc herniation, disc bulge, slip disc. Is there anything we can do besides surgery? What is a herniated disc? What is a disc bulge? How does it happen? The disc is what sits in between your vertebrae in your spine, and they kind of act like a shock absorber. So what they're made of is this inner jelly-like material called the nucleus pulposus, and it's surrounded by this fibrous soft tissue called your annulus fibrosus. So what can happen over time, whether it's small micro traumas over a long period of time or just one big injury, you can get small tears and damages to that fibrous material. That can lead to a bulge, and that can lead to a herniation. So a herniation is when that nucleus pulposus is completely squirted out of that disc and it's affecting the nerves. A bulge is just when you've got a weakness in that area and that jelly is starting to kind of bulge out of that disc. You can think of a disc kind of like a jelly donut. Okay, if you squeeze a jelly donut just enough, you're going to start to see that jelly bulge out. And if it completely bursts, well, then you've lost your jelly. So that's kind of like a disc. You can think of it like that. Now, the only way we can tell for sure if you have a disc bulge is with an MRI. X-rays don't show soft tissue, so we're not going to see it on there. But an MRI is going to show us if you have a disc bulge, where it is, how big it is, and if it's affecting anything in that area. Because what they can do is they can bulge out posterior, which is out of the back of where they are, and that is where the nerves are that exit your spine and run down your legs, your arms, and go to the other parts of your body. So if that bulge or that herniation is hitting those nerves, that's when we're going to have an issue. Now, you may have a bulge or a herniation and you have no pain, and that's fantastic. So, I mean, that doesn't necessarily mean just because you have a bulge or you have a herniation that you need to have surgery or you need to be doing something. Now, I would suggest being proactive about your care, being adjusted, being smart about your movements so you don't make anything worse and have to end up looking for those alternatives. Now, is there anything we can do? Yes, so chiropractic and physical therapy are two of the first responders when it comes to this. So these are the things you're going to do to try to mitigate your issues so you don't have to have surgery. Chiropractic works fantastic at getting that motion back in those joints so that disc can move and it can rehydrate, because your disc is going to dry out, you can say, if it's not moving. So we need to get that motion into that joint, make sure that disc is moving and healthy and getting the nutrition that it needs so it can stay healthy and not get any worse. Physical therapy is also going to be fantastic because there are certain exercises that we can do that go hand in hand with chiropractic. So chiropractic and PT are fantastic at mitigating your symptoms if you have a disc herniation or even just a bulge. Now, depending on the size, it might determine exactly how much we can do. But studies have shown that chiropractic is fantastic at dealing with disc herniation. So if you have a herniation or a bulging disc, don't let that push you away from chiropractic. It should actually push you into chiropractic. So if you're having these issues, you feel like you don't know what to do, you don't want surgery, reach out to your chiropractor. Call us. We'd be more than happy to check things out for you, and just let us know. See, it's all about motion. Chiropractic is getting motion into those joints. Any motion that we can have is going to help keep everything happy and moving, because we're made to move. When we stop moving, that's when we have issues. So don't stop moving. Call your chiropractor, call your physical therapist, see what they can do to help. If you guys have any questions, feel free to comment on this video or send us a message, call the office. Lots of ways to get a hold of us. So just let us know. We'll love to help in any way that we can.